Imagine you have a ewe or a lamb that's eating normally, and the next day you find it dead without any symptoms, without any warning. This isn't just bad luck. This is the most dangerous silent disease in sheep, Clostridial disease or Enterotoxemia. I'm Dr. Alwan, a specialist in sheep and goat diseases, and this video is important for anyone who owns sheep or goats, because this disease can wipe out the whole flock due to a very simple mistake. Clostridial disease isn't just one illness, it's a group of diseases or a group of different bacteria. These are bacteria found in the soil, and what's more dangerous and strange is that they're also present inside the animal's body, inside the animal's intestines. So the infection doesn't come from outside. The infection starts from inside the body. When conditions change and immunity weakens, the bacteria become active and release deadly toxins. These bacteria are among the most dangerous types of Clostridia, specifically Clostridia perfringens type D. The danger of this bacteria is that it releases deadly neurotoxins, and this disease is very directly related to food or feed, whether by increasing its quantity or changing its type, or by not gradually introducing it to young lambs at the start of the fattening project. First, we need to understand what causes the disease. When you suddenly change the type of feed or increase its quantity, the bacteria or Clostridia become active. The bacteria secrete toxins called epsilon toxin, which enter the bloodstream, then reach the brain and destroy it. Then neurological symptoms appear, and then sudden death may occur, sometimes without any symptoms appearing. If symptoms do occur, in this section we will talk about the symptoms that appear in cases of Clostridial infection. The animal usually dies suddenly, but sometimes it may show some symptoms, such as neurological symptoms like tremors or shaking. The animal may stagger, and sometimes there is frequent urination. The animal is unable to stand. It isolates itself from the rest of the herd and loses its appetite, and this happens in a very short time, sometimes within just a few hours. The animal eats normally at the start of the day, and by the end of the day you are surprised to find it has died suddenly. Let's move on to the next part, which is treatment. And the shocking truth that I have to tell you is that this disease is one of prevention, not treatment. In most cases, all methods of using medications, whether it's antibiotics, fluids, or even antitoxins, fail to treating the condition because the toxins have already been released, and it is one of the potent toxins that cannot be controlled and that destroys the nervous system. The next step, we will move on to some of the mistakes made by breeders that we encounter regularly in the clinic. Mistake number one is suddenly increasing the amount of feed or even changing the type of feed. There is also a common mistake where some people do not carry out the vaccination process. And Clostridial disease is not one of the epidemic diseases like foot and mouth disease or other epidemic diseases. The disease does not enter the herd, the farm from outside. The disease does not enter the farm from outside. Rather, it is endemic inside the body, specifically in the animal's intestines. But when the environment and conditions become favorable for it, such as weakened immunity or the animal experiencing stress, whether during the rainy season, extreme cold, overcrowding, or poor ventilation, all these conditions create opportunities for Clostridial disease to occur. That's why vaccination is the real solution. So vaccination must be carried out properly. The first dose is followed by a second dose after 21 to 28 days, which is the booster or the second dose. Then, vaccination is repeated every 6 months or every 5 months, depending on the severity or the epidemic nature of the disease in the area where your herd is located. It is very important to store the vaccine at a temperature between 2 and 8 degrees Celsius. All right? Vaccination should not be done when it is sunny or hot. It should be done early in the morning or at the end of the day. Vaccination should not be done during times of stress, whether it's during transportation, birthing processes, or at the end of the season of birthing. The important thing is that the animal is not exposed to any kind of stress. To protect your herd, always provide immune boosters in the water, add vitamins to the water, control internal and external parasites such as ticks and lice, and internal ones like worms of all kinds, rumen worms or intestinal worms because they weaken immunity. Try to avoid sudden changes in feed or increasing its quantity. Provide a comfortable environment for the animal away from stress. Clostridial disease is not an ordinary disease. Clostridial disease kills without warning, and if you ignore it, you could suffer very heavy losses. If you have sheep, this information could save them. Follow the channel to learn how to properly protect your flock.